The coronavirus pandemic is arguably one of the worst things that has happened in this generation. Many met the end of their paths, and many in near death situations. Society was not prepared for the initial effects of COVID 19, but along the way, lots of things have been done to suppress the virus's effects on society. Last video, we talked about the history of vaccines. In this video, we'll talk about the effect of vaccines on the recent COVID 19 pandemic. According to Our World in Data, around 62.7% of the world has been COVID 19 vaccinated. This is great news, right? Well, not really. If we put this data in a graph, we can see the gap between the higher and lower income countries. The higher income countries have a large population that are vaccinated, while the lower income countries have much lower values, since they don't have the facilities for such measures to be taken. Regardless of this, the COVID vaccines have had a huge impact on averting deaths and helping countries' economies return to normal, says the chief scientist at World Health Organization in Geneva, Switzerland. Compared to the previous pandemics such as typhoid, meningitis, and polio, the research in terms of developing a vaccine has been substantially faster than any other disease outbreak. Because of the swift vaccine development and vaccination operations in communities, we can achieve something that is called herd immunity, where a large group of people are all immune to a certain disease, meaning that the disease can't spread amongst many people. Going into more detail regarding herd immunity in the COVID-19 pandemic, many professionals did not believe that herd immunity could end the pandemic. The main idea of herd immunity is to vaccinate majority of the population, while a small portion of people who are not able to get the vaccine due to issues like a severely compromised immune system or certain allergies don't get vaccinated. With most of the people vaccinated, theoretically it should be much harder for the virus to spread, as most of the people are already immune. However, in certain viruses, it may not be the best idea. This was the case with the coronavirus. Because it mutates regularly and has many variations that are present, some of the vaccines don't work with all types, meaning that herd immunity won't necessarily be effective. Instead of trying to reach herd immunity, a combined effort including lockdowns where people were required to stay home and avoid as much social contact as possible, as well as the mask mandates which greatly reduced the spread of the virus through the mouth and nose, and vaccines have helped reduce the bigger picture regarding COVID-19. However, the pandemic still continues to this day while we await the eventual annihilation of the virus. So the big question here is, has it helped? Well, even after all the points we've talked about, it's a hard question to answer. I believe that it has, even if there is a fair bit of solid information saying that the outcome wouldn't have changed had the vaccine not been made. I think it was very crucial in some certain areas. When some urgent things like business trips come up, some people have no other option than to travel. Had the vaccine not existed, many more people would have been infected and the virus would have spread very quickly in various areas around the world. So there it is, the vaccine overall has helped. But then again, it is only helping a certain group of people, while doing nothing for others. And here I'm talking about the socio-economic gap between rich and poor. Like mentioned before, we don't see much effect on vaccines on poorer countries, as they simply can't afford them. It may also affect people who don't have facilities to go get vaccinated. For example, people who live in rural areas without transport. Some companies have done vaccination drives in poor countries and rural areas to try to fix this issue. While this is great and does have a good effect, it is simply too small scale to have a big impact on the pandemic. Regardless of all the negatives that have been said, it is always recommended to go get the vaccine if possible, so that we can slowly drive away this hated pandemic that never ceases to escape our eyes.